Hello everyone, my name is Shaina and I'm a physical therapist. Welcome back to my channel. Today I'm going to talk about piriformis syndrome. This usually happens when the piriformis muscle located deep down in your buttocks gets tight or irritated, and when this muscle goes into spasm or inflamed, you will feel pain, tingling and numbness around your hips, as well as the pain will go down to your legs. A lot of time people say they have sciatica and the pain is originating from the hips and not from the back. That's because the sciatic nerves run down the piriformis muscle and sometimes through the piriformis muscle. So when this muscle gets tight, it compresses the sciatic nerve, which causes pain, tingling, as well as numbing going down to your legs and sometimes near to your toes. Today I'm going to demonstrate best stretching exercises for piriformis muscle to release that tightness, and also some strengthening exercises for glutes as well as hip rotators. So let's dive into the exercises. The first exercise is a piriformis stretch. Lie down on your back and lift your left leg up and bend your knees. Now cross your leg towards the opposite side and pull your knee towards the ground. You will feel the stretch near to your hips. Hold this position for at least 30 seconds. Breathe naturally. And relax. Switch other side. Go for at least 3 reps each side and do it twice a day. And relax. The next variation is you're going to bend your knees, cross your one leg above the other. Now take your hands in between the thighs and pull your thigh towards your chest. You will feel the stretch here. Hold for at least 30 seconds. Breathe naturally. Relax. Switch other side. And relax. The third variation is seated piriformis stretch. You can do it on the chair or sofa. Just cross your one leg above the other. Now press your knee down and bring your body forward. You will feel the stretch under your hips. Hold for at least 30 seconds. If you don't feel a lot of stretch, then what you can do, turn your body towards the right side, and then you can look for the tightness. If you feel the stretch here, stay here for 30 seconds. If not, turn your body towards the left side. Just move around and see where you feel the more stretch. And relax. Switch other side. Press your knee. Bring your body forward. Hold for 30 seconds, breathe. You can turn towards your right side and then look if you feel the tightness here. If not, then look towards the left side. And relax. The next exercise are the strengthening exercises. The first one is clamshell. For this one, lie down on your side and bend your both knees. You can place your hand on your waist. Now open your legs. Hold for at least 1 second and bring it back. Go for 10 to 15 reps into 2 to 3 sets. If you want to progress, then what you can do, take a TheraBand and place it around your knees. Get it the same position. Place your hand on your waist. Now go for resistance training. You'll feel more pressure. You can also progress with the TheraBand. You can start with yellow, progress to red, blue, and relax. Now switch towards your left side. You can start without the TheraBand or you can start with the TheraBand, however you're comfortable with. So place your hand on the waist and go for clamshell. Make sure your upper body is not rotating. It's just your knee and hip movement. Go for 10 to 15 reps and relax. The second exercise is bridging. For this one, you're going to lie down on your back and bend your knees. Your feet should be shoulder width apart. Now from here, lift your hips up, squeeze your glutes, hold for 1 second and bring it back. Go for 10 to 15 reps. Relax. If you want to progress, then take the TheraBand, place it around your knee joint, slightly above your knee joint. Now what we're going to do, we'll go for bridging. Now take your knees apart, hold for 1 second, bring it back and down. Go for hip abduction with bridging. (10 to 15 reps into 2 to 3 sets and relax. The next variation is you're going to stay in the same position. Now your sole of the feet should touch each other. We'll go for bridging. So get in, your knees should fall apart. Now from here, lift your hips up and bring it down. Go for 10 to 15 reps into 2 to 3 sets and relax. The next exercise for hip abductors. For this one, get in a side lying position. You can bend your right knee and keep your left leg straight. Place your hand on the waist. Now lift your leg up, hold for 1 second and bring it back. We are working on hip abductors. If you want to engage your glutes, then what you can do, go for abduction, then kick back slightly. You'll work on your glutes at the same time and then bring it back. Up and slightly back. Up and slightly back. Go for 10 to 15 reps into 2 to 3 sets and relax. The last exercise is fire hydrant. For this one, get in all four and your knees should be hip width apart. Now from here, lift your one leg up and go for side kick. Hold for 1 second and bring it back. Make sure you're not twisting your upper body, just you're engaging your glutes and your hip abductors. Go for 10 to 15 reps. Switch other side. And relax. I hope you feel better with these exercises, and if you have any questions, you can check out my website rehabwithshaina.com and you can message me there. And you can also comment and let me know about your progress, and I will see you in the next video. Thank you.